The Rauner administration decision to lay off 124 nurses who work in Illinois correctional centers sent shockwaves through the state nursing profession, with many nurses saying the move not only is shocking, but is also disrespectful to nurses.
It was devastating news. It's confusing news because we don't understand why you would take experienced, long-term veteran corrections nurses and just get rid of them.
According to a letter dated March 18th from the Illinois Department of Corrections, the layoffs take effect on June 15th and affect nurses in 12 correctional centers. Alice Johnson is the executive director of the Illinois Nurses Association.
We were extremely dismayed to see the level of disrespect that the governor has for the work that these nurses do with the language of the layoff notice. And we would urge him to show respect for the nurses that have given so many years of their lives to state service and the people of Illinois.
Illinois and the nation is facing a looming nursing shortage within the next 10 to 15 years just because of the population is aging, the prison population is aging.
The hiring freeze and the mismanagement of correctional center health care has created mandatory overtime for existing nursing staff. Valerie Hoffbauer is a registered nurse at Stateville Correctional Center in Joliet.
Sometimes we work from 7 in the morning to 11 at night. That's a full entire day, and then expected to come back the next morning by 7 o'clock in the morning.
Medical care for the state's approximately 50,000 inmates is administered by Wexford Health Sources Incorporated, a for-profit company that was given a 10-year contract in 2011 worth $1.3 billion. Since the contract was announced, records show the Pittsburgh-based company has been sued dozens of times in federal court in Chicago by inmates alleging substandard care. A wide-ranging audit of the health care delivered in Illinois prisons, conducted by an outside agency, found sweeping problems in the medical system at the Illinois Department of Corrections. The end date of the contract between INA and the Department of Corrections was originally June 30th, 2015. But the terms of the contract have continued under a tolling agreement. But INA contends the Department of Corrections has refused to negotiate in good faith on a new deal. The Illinois Nurses Association filed an unfair labor practice claim against the IDOC, claiming the department has refused to bargain in good faith. INA's filing comes after a long series of violations of labor law and poor management by the Illinois Department of Corrections.
We'll be proceeding with our unfair labor practice as well as engaging in a public relations campaign to educate the public on the impact of subcontracting on the patients and also on the bottom line for taxpayers. We believe ultimately this is a money-wasting move, not a money-saving move.
INA has filed a number of unfair labor practice acts and is optimistic these legal filings will halt the layoffs.